Hello and welcome. Let me get our guest joining us today. Well, I want to thank you all for joining.
Hi. Hi, Tara.
Hi, Jenny. Welcome. It's a pleasure to have you.
Thank you.
Yeah, welcome everyone to Ask the Insider. Today we're going to be talking about celiac disease, and I'm absolutely thrilled to have a colleague, Jenny, and she's also a mom who deals with celiac disease. So our conversation today is adopt and survive celiac disease and the gluten-free lifestyle. And so it's an absolute pleasure to be able to meet you and to get to know you and your family better, Jenny. I do want to say, come on and join us. Join the conversation by chatting in the chat bar, and we're going to start our conversation. So, Jenny, tell us a little bit
Thanks
about
for having me.
Yeah, tell us about yourself.
So I'm a PA. Past 20 years, I've been practicing rural family medicine, and I have 4 wonderful children and a husband of nearly 25 years. And my 4 children have celiac disease, so we've had to learn a lot through this experience. So yeah, you stumbled upon my website, and that's why I'm here.
Yeah, I'll just briefly tell that. So my name's Tara Brunner. I'm a practicing PA myself in Arkansas. I'm also a clinical educator for Thermo Fisher Scientific. And so with that, we deal with autoimmune disorders as well as allergic diseases. So one day I'm looking for celiac information, and I come across this fantastic blog. And I'm reading a little bit about your story, and then I realize you're a fellow PA too. So we have two things in common. We're PAs in family practice. We're moms. And so I just felt like I needed to connect with you. So it's been a delight to get to know you and get to know your story. So today's conversation is just about you telling us your story and how your family is navigating this. So tell us a little bit about what your mission is, and we're going to walk through what this journey has been like with you. So tell us a little bit about your mission.
Sure. So everything started in 2017. I can't believe it's been that long, almost 5 years. My daughter Grace was 12 and was just having a whole bunch of different symptoms, things like headaches or joint pain. She's really fatigued. Here I am, a medical provider, and sometimes families of medical providers get the shaft, you might say. we spend all of our energy on our patients, right? Not our families, which is kind of sad. But so this went on for quite a while, and we checked into a few things, but never really dove in because she wasn't terribly ill. But things finally caught up to her, and she really did not feel well. It affected her day-to-day activities, her energy level, even probably some of her mental function. And so we needed to dig in more. And finally, she gave me more signs. Whenever she'd eat a meal, she started scratching. And, then I knew it was something she was ingesting. And so then I knew we needed more testing. And I sort of assumed it was gluten, since that's a fairly common problem. And so we did the testing, and sure enough, she was positive for the antibodies for celiac disease. And that's where the journey originally started. After that, she saw a GI specialist who explained that this is a very genetic disease. So your immediate family members, there's a good likelihood of somebody being affected. So recommended that I start talking to family members and testing the kids. And of course, my husband and I got tested. And lo and behold, all 4 of our children tested positive. So that's where things began. It was a huge learning curve. The American diet is packed full of gluten. It's hard to go to a restaurant, go to a grocery store, eat any meal for any event without that. And so we had a lot of learning to do in our own home, in our own kitchen, and when we're away from home as well. So it was a tough journey, but it took about a year, and we all kind of settled into the lifestyle. And just because of the challenges and the experience and the things that I learned that could make it easier for others, I decided to create a blog and a website. And I am the least technically talented person you'll ever meet. But I did it with a lot of frustration and some help. And so I published a blog and wrote a number of articles just to help other people navigate through this. So that's my story.
There's a lot more details I'm going to poke into, because we say that simply, but like you said, when your daughter is young and presenting symptoms, you sometimes wonder, especially with the gut, it can be a number of things. Is it anxiety for kids? Is it truly GI related? Is it irritable bowel? And so you mentioned a blood test, and that's tissue transglutaminase, which is a common marker for celiac disease. So you mentioned what were her results like? And I suspect that's the test result that your other children had as well.
Yeah, yep. That's I believe that's one of the most reliable test markers for celiac disease specifically. And it's a really good test, actually. It's not 100% perfect like most lab tests, but it's a really good one. And so there's a range, and she was the highest. She was greater than the highest level of tissue transglutaminase antibody, which didn't surprise me. All of her symptoms that she was having, there was a lot of inflammation in her body caused by that autoimmune response. And so didn't surprise me that the levels were really high. And so we started making some changes with her, and it took a while for her to feel better, because there had been a lot of damage inside of her gut. It was probably about a month later that we tested, myself, my husband, and the boys, and my husband and I were negative. So obviously one of us is a genetic carrier. We didn't do the genetic testing. Sometimes insurance doesn't cover that, and I didn't feel it would be helpful. But the boys' transglutaminase antibodies were really high as well. So
now,
that came as quite a surprise.
Yeah. Did your boys have any problems? Were they exhibiting?
In retrospect, Grace for sure had the most symptoms. My youngest boy occasionally would have a bellyache. Not often miss school because of it. My oldest son, hardly anything. No, I would say nothing like Grace. If it weren't for her, we still may not know, so interesting.
Right. Yeah. So not only did she have the blood test, but she also had the scope or endoscopy where they looked down into her stomach. What was that journey like for you and for her?
Yes. So the GI specialist said to confirm the diagnosis, they still recommend doing even though the test is pretty good and her symptoms are really consistent with the diagnosis, it's still really recommended to do the endoscopy, to do biopsies to confirm the diagnosis, and also just to see how severe the disease is and make sure there's not any other complications associated with it. And so she really did not want to do that. She was scared you have to go under anesthesia and go to the operating room, and she was only 12, and she had to fast, and all my kids like to eat a lot. And the surgeon was running late. And so I don't think she had the scope or went in till almost 1 o'clock in the afternoon. And she had quite a bit of nerves till then, but it's a fast test. She did really great. He came out and told us he could clearly see evidence of the damage in her, intestinal lining, and she did wonderfully. And it's a low risk procedure. My boys decided after discussing with the GI, he said, it's standard to do the test to confirm, but with your family history and some of their other labs, he said, you can assume that it's celiac. And I kind of talked him out of doing the scope on my boys. I thought that was a little invasive and a little more than needed to be done. And I felt there wouldn't really be great harm in eliminating gluten. And so, yeah, we assume that they all definitely have the disease.
I have a question. So it was about a month before she had, from the blood test till she had the endoscopy. And they, once you have blood result, you might want to stop the gluten, but to have the blood test as well as the biopsy, you have to be continually eating gluten. What was that like for her?
Exactly. So the blood test was a relief, right? Because we had an answer to why she was feeling so lousy. And so that was a relief. And she was so used to feeling that way because it had gone on for many months. So for her, that wasn't so bad. The hard part was after her scope, there was still a window until my boys got their test results. And so she thought she was the only one in our family with it. And
Yeah.
that was really, really hard for her psychologically. And there was no one else at school she knew with it. And, just having to constantly be really limited with what she could eat at a friend's house, or a number of her friends would go to the Mexican restaurant and hang out after school. That was always a challenge. She just felt really lonely in that, and I understand that. And so when the boys got their results back, there was almost an element of relief that she wasn't alone, and we were going to be doing this together as a family and figuring it out together. So, yeah.
There is some relief, of eliminating all gluten from your entire world, I'm sure, because it does affect all the family members, and it's the best management. So I will say that's really the only management that we have right now for celiac disease is removal of gluten from the diet. And
Yeah.
so you have some really great resources. So I'll just, I just want to mention, if you haven't already, look at the gluten-free mentor. Go to the blog, go follow her on social media. But with that, you have some really good resources. What's it like sending your kids out to a birthday party, or sending them to school lunches, testing out new recipes? Tell us a little bit about the journey post diagnosis.
Yeah, that the hardest part for sure is the social. At home you can make it work, right? You can remove gluten from your kitchen. You can learn how to prevent cross contamination. And if for us it was easy, right? Get gluten out of the kitchen because we're just going to treat everybody the same. And but school at that time wasn't providing gluten-free meals for the kids, so they packed lunches for a few years until school now does provide a gluten-free lunch program. um, Really don't go to restaurants anymore, right? We used to enjoy a really good pizza place in town, Gus and Tony's, after a sporting event, or when we were really tired at the end of the week, right? Just grab a pizza, go out to eat. And that had to stop. We live in a rural area and don't have a lot of gluten-free options for restaurants. Some bigger cities do. Um, I think especially hard though is like being invited to a party, like a birthday party, or like even a bigger party, like a graduation or a wedding. Really, really hard. And what we learned to do is just feed them before they would go, or take their own food in their little cooler, and just got used to carrying that and having it with. And yeah, that's a challenge. It still can be. They have some amazing friends and their parents' friends that are really concerned with that and want to make sure they eat healthy and don't get contaminated. And I really, really appreciate that. But yeah, we're managing pretty well.
Good. Yeah, it's such a rare disease that affected all of your children. That would
Yeah,
have
I remember the doctor was he, he thought, maybe one of your other kids, but he never imagined all four. So they must share a lot of genetics.
Yeah, I just popped up one of the questions that we have, and Jennifer asks, how do you make the transition manageable? What are the most impactful sources of gluten to eliminate first?
Yeah. So I kind of went bonkers. I'm going to be honest. I was like, we need to get this out of their system today. And that's my medical background haunting me, right? Like, I know medically what happens inside the gut. I know that it's ugly. I know that the kids aren't absorbing what they need. And they're in this period, right, where they're growing and going through puberty, and I want them to be healthy adults. And so literally I was a cold turkey type. I was like, we're just gonna were just going to buy all kinds of alternative products. And I bought probably an overwhelming amount of stuff. And then we tried a bunch of stuff, and then we got rid of what we didn't like, and then we kept what we did. Also, I have no idea how we would have ever survived without Google, right? Because there are some amazing resources, moms who've gone through this, all kinds of people who've been through celiac disease and travel with celiac disease and have all these special circumstances and make amazing recommendations for favorite products or, and so I used a lot of those resources. So yeah, we kind of did it cold turkey, but I will point out that because I have four in my home, we're like a little testing site for gluten-free products. And so I did post on my website a whole bunch of my whole family, some favorite products that we really love, and that when people come over, they really are shocked that they're gluten-free. And the market has just exploded, which has been a blessing, that there's so many options for them and things that taste good. And so I did post a lot of that on the website. And it's definitely an easier transition today than it was, say, even 10 years ago.
Sure.
I feel really bad for people back then who didn't have all the options. So
yeah. So there's another good question from Jennifer. I appreciate your comments, Jennifer. It's, we know gluten's in other things. I found out recently that's in Play-Doh. What about medications or cosmetics? Have you run across that problem?
Yeah, so great question. Very uncommon in medications. Foods have labeling regulations, right? Where you can, to some degree, you can figure out if gluten is present in a food product. And I do talk a lot about that on my website, where that can be missed on a label. But meds are harder because they don't have to list gluten. However, in the United States, it's a very uncommon for them to use gluten as a filler in medication. You're not going to run across it very often. So you do need to know that. But hop on my website, type in the search bar medications, and it explains there is a database, online database, where you can look up medications and check them for gluten. You can also ask your pharmacist, who can call the manufacturer and check for you. You can call the manufacturer yourself as well, because there's usually a number in the package insert. But the good news is you often don't have to be concerned. Some of the over-the-counter vitamins and things will have gluten. I try to stick with gluten-free vitamins, and I have a few of those listed on my website, the vitamin companies that we like to go with, because vitamins are often recommended, especially when you're first diagnosed, because sometimes you're vitamin deficient. And so they're usually okay, but there are certain brands that I feel are more trusted, and that you can be assured are gluten-free.
Thank you. For those that have just chimed in, that's the gluten-free mentor.com, and that's her, or is it .com? It's .com, right?
Yep, the glutenfreementor.com. Yeah.
Yeah. So I want to make sure that that we have that resource. And I also want to add to that you follow social media with her. She has some, holiday tips. So knowing, we have hats, you and I, we have the mom hat. We have the PA medical hat. So my question to you is, sometimes when we have patients come and say, well, I was looking at this on social media, or I looked this up on Google, sometimes we cringe. How can those who may be dealing with this, that are listening, how can they approach their healthcare provider and have that conversation?
Yeah. So, your healthcare provider, just you have to be a good advocate for yourself, right? And so if you, like I said, celiac disease can have no symptoms to vague symptoms to a whole lot of symptoms, and it can affect just about any system. Like I said, headaches and joint pain and stomach and rashes, etc. And I would say, number one, if you have a close family member with celiac disease, especially immediate family member, you really need to be tested. This is something you can deal with. This is something that's manageable, and it's just not good for your health, for your body to be so inflamed. And so ask your doctor for the tissue transglutaminase test. It is such an easy test, and it's an affordable test. You do have to be eating gluten when you have that test. The gluten is what triggers sort of the cascade of events that causes those antibodies to rise in your blood. So you can't eliminate gluten and have the test. You have to be eating a normal diet full of gluten and then request the blood test from your doctor. So the family history, request the test. Symptoms you're concerned about, certainly request the test. This is not an unusual request to be tested for celiac disease, and anymore it's so easy with that blood test. So by far and away, advocate for yourself. Talk to your doctor about symptoms you're concerned with. Request the blood test. Yeah, that's my recommendation.
Right. I think that's a great, you said be an advocate, champion for yourself, because
right.
GI issues, you and I both know, it can be a whole range of issues. So we're talking today about celiac, which is an autoimmune disorder,
right.
versus other things like intolerance or even food allergies, something. But you're right. Just ask the question. I think that's great.
Yeah.
So,
I'll mention that really quick that it's so confusing, right? This is an autoimmune disorder versus an allergy. So when I say stuff yourself with gluten, I would never want you to do that if you have a wheat allergy, right? That's dangerous, but that's an entirely different process that's happening with your immune system, and you can get anaphylaxis, which is very dangerous. But eating gluten when you have celiac disease is not going to be dangerous, but it is going to have some pretty harsh long-term effects on your GI system and how you digest your food and absorb your nutrients. And that affects every organ system eventually. So even though you won't get anaphylaxis, there's a lot of trouble going on the inside that needs to be addressed.
Right. Right. So again, all of the resources that you've gained today, or that we've been able to hear from you today, are so important for us to know. Even as healthcare providers, we're continually learning this process. So again, advocate for you and your family members when you go see your healthcare provider. Jenny, I really am so glad that I stumbled upon your blog.
I'm glad too.
And so there's resources on social media. You can follow her there, her blog. We also have Allergy Insider, which is on social media, as well as at allergyinsider.com, which can take you through some different disease processes for autoimmune and allergy. So resources are out there. So I want to encourage you to continue to comment in this conversation. But Jenny, do you have any final words for our audience today?
No, I just want to say I'm really glad too that you stumbled across me. I just love to educate and get the word out and help people. That's my mission. And so thank you, because this really helps broaden the audience for me. I appreciate it. And now I have another new PA friend. Yay, I'm so happy.
Right. It has been a pleasure. So I want to thank all of you who have joined us today, and continue to follow us. Coming this spring will be another Ask the Insider regarding allergies, spring allergies. So again, thank you again for joining, and we hope to see you soon. Thanks, Jenny.
Thanks, Tara.
Bye-bye.
Bye.